sorry you're getting to see all the ways that you get off a plane and arrive somewhere you haven't been before and then quickly set up your presentation. So usually I do this all behind the scenes. But thank you very much for coming to speak to me. I would request that we're going to lower the lights for the first part of the talk. If we could close the door, lower the lights. I'm going to show you my recent visit to the aftermath of October 7th, which happened in the Gaza envelope. And that's the reason I'm in the Republic of Colombia, to present evidence that I gathered as a human rights observer and as a physician, which I elected to do as a personal decision. And so to request, because the material is very serious, if I could request that we're very quiet, and all of these images are now in the entrusted with the Embassy of the State of Israel here in Colombia, because I provided it and I have obtained the license for South America for 1 year. And so these images could be used for educational reasons. But I prefer that we don't just put anything up gratuitously for social media, because we're looking at remains of what I think was a genocidal massacre. That's all. So, very good. We're going to play the first slide, which is a video. Oops. That's not what it... How do I press play? This is going to be annoying. Sorry. I see kind of smoke in the distance. I don't know if that's my imagination or if that's...
No, because the work order, so the smoke is from the concrete and the stone.
I see.
There's no fire over here. Maybe we'll pass places by later, they still have fire.
I see.
Because they still bomb us from last night. They always bombed.
I see.
So maybe a small grenade, a small...
emissions.
Yeah, small emissions, yes, yes.
Okay, so we'll follow you over. This is the...
Now what you see here,
October 20th.
this is a house
Kibbutz
of family. All of a sudden, 7 o'clock in the morning, those Hamas people came here and bombed the house and tried to, with emission. Now what you see here, because the soldier came and the Hamas was inside, so they ran over with the bulldozer to make him run away outside. Yeah.
However, I see these bullet holes in the wall.
Yes, this is a house that took plenty of bullets.
There's a window there that seems to be pushed in.
Yes.
And many bullet holes here, even up there.
Yes, yes, yes. They bombed the whole house because they want to go inside.
The front lawn.
Yes, we can go see here.
Nice, beautiful plants that were growing.
Those peace people that live here, very peace people.
This is a civilian volunteer that's showing me the way in. And I'm hesitating because I'm worried about what I'm going to see.
Now maybe you see here. This is a...
I'll get out of the frame. You want me to...
Okay.
Stay where? You tell me what to do. What do we see here?
What you see here? What you see here? Here it's... This is ocean of blood. What you see here? This is blood. What you see, it's become black right now. This is blood. There was plenty of blood here.
It's on the doormat. It's on the door. Are you able to see in this?
Yes.
It's soaked through the doormat. So what is the Hebrew on the doormat say? Is that welcome?
Welcome. Welcome.
What did it say?
I will go inside first. Let me see if you don't have a... Come over here. 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 This is a family. It's very swell, but I will walk in. This is a family. Look, the blood. This is inside the family house. Look, the blood here.
This is a huge amount of blood.
They attacked the house from the two places, from here and from there.
So
Also, from everywhere.
So they were surrounded, this family.
I don't know. From when I see the blood, you see, come with me, come with me.
This is
Come with
13
me.
days
I will.
of the attack.
Look, they stab people, honest people, peace people. When look, they kill him with a knife. All this is blood.
It's also here on the tiles. And then
No water.
there are some boot prints and footprints.
Yes, because they was walking inside, walking around.
It's just an ordinary living room. Stop this slide, please, and go to the next slide. And hold off, don't play it yet. So that continues. And that was my first experience of going into a home where there had obviously been a human rights violation. That is the remains of a family that was slaughtered. And this was part of the operation that Hamas, which is an Islamist jihadist group, had systematically perpetrated. And I have about a 25-year career of looking at radical Islam as a Muslim woman who believes in Islam. So this was just a sequence of events in an odyssey that I've been following for almost 2.5 decades now. So you saw in that image a huge amount of human blood. You know the average volume of blood in a human being is? Does anybody know the answer? Yep, that's right, between 4 and 6, 5 liters. So there's obviously a tremendous volume, and there's a weapon. And then the video goes on and shows other violence. They wanted to show me another room in this house, and so now we're going to play this video clip. There's a little play, no sound on this. Can we see? This is what's called a safe room. We had seen the window from the outside where there were many bullets. Obviously, there's a mattress. That's the window we saw from outside. And I think there are also photographs of the family, but I asked the cameraman not to focus on that. And this is a place that normally families would shelter when there is incoming missiles from Hamas that are targeting civilians, which happens all the time and has been going on for years. So they spend a few minutes in this room to shelter from that. We'll stop there. I gathered this evidence over the course of 10 days. And I saw this room, but I really didn't understand what the room most likely represented and why this room looked different than all of the bloodshed in the kitchen. And we'll come back to that, and I want you to think about what could be the difference as I surmised. Let's go to the next slide, please. Keep going. Sometimes the image is going to appear. I looked at many houses like this. I also started to see people that had survived and were coming back to their houses for the first time to get a few belongings because all the civilians had been evacuated. And here you see me interviewing a person, not for television and not for a magazine, but for what's called the Shoah Foundation, which is the repository of the world's largest collection of oral testimony about genocides, Rwandan genocide, Holocaust is what initiated it, Bosnian genocide, genocide in Darfur, and now this. I was the first layperson to do an interview. And so this man tells us how he survived, protecting his 2 children and wife in a room for 10 to 12 hours. We'll keep moving through these images because I want to get to things that are more medical. Keep moving. Skip this slide, please. Skip this slide. We keep skipping. Let's just play this video. So he's, oops, sorry. Yeah, that's it. It's a little tricky. So he's telling me what's happened. He's already told me the story. I've talked to him about 45 minutes, and he's going to lead me into his house and show me.
Yeah, I can show you.
Everything happened. This is the front of the house or the back of the house?
This is the front of the house.
The front of the house.
Just packing here some stuff.
And you know, it's all very makeshift because we only have one.
Yes,
microphone.
I'm just picking up some stuff.
It feels a real violation to go into somebody's private home. Even just entering the home, even with the homeowner, felt like a real violation. That's why I'm sort of very hesitant where I'm going and I'm following him.
Here is the safe room, and this is.
The safe room is show us the safe room.
Yeah, I will show you the safe room.
Here and make sure we understand where everybody was. So he's showing me where his family was sheltering.
Here,
And
Maya and the two kids, and later I
Yael
was.
and
Shalev.
Shalev, they were here.
Yes.
And there's concrete behind this window.
This is the steel window,
Steel window.
and this is the window where I told you that on the other side, when we came out, I could hear it, but when we came out, there were bodies of two terrorists just outside the window, and there were bodies of two other terrorists on the road behind the house. I was using this to lock the door.
So the doors are not normally lockable in the safe rooms because they're only for a few minutes when there's a warning of missiles falling from the sky. And so families have to get in there because it's shrapnel proof. So he's explaining that to me.
And I was putting pressure on this.
So you were standing here like this?
Yes, I said when they're gonna come, I will put more pressure and just.
Is this designed for that?
No, it's a keyboard stand.
It's a keyboard stand. Wow, but you.
Yeah, I don't know.
He had one weapon in his home.
And
He's going to say something very important in a few minutes when the sound comes up. So he had one weapon in his home. He was sitting on a stool.
this door, this whole room, it's actually a shelter against bombs.
Bombs, okay.
And it's not a shelter against terrorists that want to exterminate the people.
Stop this slide. We'll stay on that still. That word exterminate. That really was shocking to hear it because he's not a scholar of genocide. He's not a scholar of totalitarian ideologies. He's not a scholar of he's a software engineer. And so what he just experienced is on that day, 12 to 14 hours of being aware of what was going on because he could see the rampage of the Hamas commandos. All the families had cell phones, including the children. He had a 13-year-old and an 11-year-old that were in the safe room. They were getting thousands of WhatsApp messages from teenagers their age, their friends, that were meeting their final moments. And he didn't know when they were coming for them. Many families could hear the terrorists outside of the window. And eventually, most people did not survive because they shot through the door, they threw grenades in, the families were then caught in fire, and then just had to jump out of the window where they met their executioners. So when he used the word exterminate, that was on my first morning, I was already beginning to think of genocide, and we'll hopefully talk a little bit about definitions of genocide. Does anyone here know this place where I'm sitting? Can you guess what it is, this place? It is close to the kibbutz. It's not a kibbutz. Do you remember the other event that happened on October 7th while the kibbutz communities were targeted? What was the other thing that had occurred? Music festival. Yes. So this is the Ream Music Festival field, and this is the same day, October 20th, and around us is strewn all the remnants of people that had been removed, things that you leave behind in a picnic, and so this was a place where I think over 330 people had lost their lives. 34 people were kidnapped and abducted from here. And he's telling me his story about how he came to respond only to actually remove 200 bodies from the scene and bring them to the place where the bodies were going. So we also took his testimony. We can go to the next slide. This was the neighbor of the man whose house you just saw. The man who walked through the house and showed me the safe room is Dror Shayesh. His neighbor is this man, Rami Gold, who was in the house next door. And he's 70 years old. And he can't really lie down. He was sitting down on a chair, hiding behind a flower pot with another retired general. And they happened to have some weapons. And so as the Hamas were approaching, they were acting as snipers and therefore saving many, many families until they got down to their last bullet. And then they had a discussion as to who would fire the last bullet, who was the better marksman, who was the better shot, who had the better weapon. And they were then contemplating what would follow once they ran out of bullets. Fortunately, somebody came with ammunition, and that's why he's here to tell the story. And he actually saved the entire family that was next door. And this wasn't in collaboration. People didn't know who was alive in the house, who was home. This was just his instinctive response. What's very interesting is he's a veteran of the, that's fine, he's a veteran of the Yom Kippur War, but his father was an American soldier enlisted in the Allies that liberated a Nazi concentration camp at the end of World War II. So you have the father responding to the aftermath of one genocide, and the son living to see the aftermath of another genocide. We'll play a little bit of this because it doesn't really matter what I'm saying. This is
so today we came here yesterday, and the family wanted me to see where they live.
Family.
One of the things they showed me was their camel. We saw 5 camel yesterday. I think there were a couple that are over there in the distance. We can see those camel right
Bedouin
behind you, Dan,
Muslims.
where you're filming.
This is in the
you
southern
see them
Negev.
there. And then there's this camel. He's a white male, and if you can listen to him, he was with this wailing sound yesterday. And before we just filmed the testimony, I asked the person bearing witness, or rather the person giving the testimonial, why the camel was crying. I said the camel has been crying all day yesterday.
The whole time I was
and he told me
family.
Ever since his nephews lost their lives in the Hamas rocket attacks, the camel has been crying.
So we
Very
can stop
poignant.
this for the moment,
he said
please.
that off camera.
Yeah, let's just stop. And this was the person telling me the story. This is Mr. Syed Al-Quran. He's a lawyer. He's an Israeli. He's of the Bedouin population, and he's Muslim. And early in the morning, when the first onslaught of tremendous Hamas missiles began, missiles fell on a small makeshift, not kind of container, but a building the Bedouins live in, not necessarily brick structures, but structures which are partly prefabricated. And all 4 nephews were killed, aged 10 to 16. And he didn't want to show his face on camera. When you ask somebody, some people want to show their face, some don't, some want to be completely unrecognizable. And so this was his preference, so that's why you see just the back of his head. But when we got to the part about his nephews that were unfortunately simultaneously assassinated, he took the pen from my hand and he wrote their names out in English and put their ages and told me about the 16-year-old who had been planning to go to medical school. And so what I want people to understand is while this genocide, in my belief, was an Islamist, systematic, premeditated target of Jewish people, when there is anti-Semitism that goes on, non-Jews are also in the crosshairs. And more than 19 Bedouin families lost somebody that day, and many of them very young children. One, I think, was a pregnant woman. We'll keep going. This was very interesting, actually, and I didn't point this out to my other medical students. This is a doctor, and he is also an Israeli Arab, which means of the Bedouin family, Bedouin background, but he is a family practice and emergency room physician. So on the day of October 7th, I'm sitting here talking to him for about 2 hours in his home. On October 7th, he was going to report to duty early in the morning. So he was driving in his car at about 6:30 when his wife said, you know what, I've heard there's quite a few missile attacks. Could you pull over and put your bulletproof body armor on, which he would have because he would respond to terrorist attacks, he would respond to car accidents and other issues. So he did that. And then he reached a roundabout, which has become, unfortunately, iconic in this terror attack. And he saw what looks like an Israeli soldier. So being law-abiding, he stopped the car. The soldier called him out and then immediately stripped him of his body armor, took his shoes away, took his cell phone away, zip-tied his wrists, and then prepared to execute him. And he said, you know what, I am an Israeli, but I'm a Muslim. And so he was pleading for his life. And a dozen Hamas commandos were debating what to do with him. And his first language is Arabic, but also he's fluent in Hebrew. He communicates with patients in both and treats Israeli patients that are both Arab and Muslim and Jewish and Christian. So he thought this was his last moments. And then he said he heard the Hamas discuss and say amongst themselves, we have now found our human shield. We're going to use him and the Israeli Air Force won't strike us. So he heard them having that decision in their words, and he again took the pen out of my hand and wrote the Arabic dialogue that he had witnessed them saying, and that's in a notebook in my home in New York. And then he remained there on the roundabout for over 3 hours, and at that intersection, unknowing citizens that were arriving, driving to go somewhere, were targeted, and the drivers were executed, usually with one bullet, and then the car would crash. Then the Hamas commanders would come around and at point-blank distance execute the passengers, which were often children. So he saw 17 motorists and their families that were executed in this manner. He's wounded here. He's got a soft tissue leg wound, which ultimately he treated it himself, because when he presented to the emergency room, there was already an overwhelming amount of fatally injured people, and he realized that he needed to take care of this himself. But he was being held captive, and Israeli police called out to him and said, "Are you okay?" They didn't know if he was alive, and he nodded, and he said, "Yeah, Ken, I'm okay." And then they executed those police officers, and then 2 more Israeli police officers came and essentially rescued him, and they had an interaction, a gun battle with Hamas. So now what's very interesting is he said to me, I want to sit and talk to you, I want to tell you my story for as much as you want, and I want you to tell the world. And that day I didn't have a cameraman, so I said, I'll come back, I'll bring the cameraman, we're going to film this as well. And then when I returned the next day, he was not there. And his wife, they're of ethnically Palestinian, even though nationality is Israeli. His wife had relatives in the West Bank, and they said, please don't say anything, because they continued to be terrorized and continue to be fearful that while they'd spared his life on this occasion, they might not do so again. And so I realized that the terror continues even after. Obviously there's all kinds of medical complications, post-traumatic stress. There's been a very recent report of very high numbers of suicide in people that survived the music festival. But this is real terrorization, where they're fearful of their own community and elements inside their own community. And he ultimately did give an interview in Hebrew to an Israeli channel. So this is that day. Let's keep going forward. Now we're going to start to look at some difficult material. And much of your medical career, everything I think that a doctor does is difficult. Patients, when you're a doctor, you have more intimacy and you are closer to your patient than their spouse or their priest. There's almost no one who has no shield between 2 human beings than a doctor and a patient. And so patients will often show you things that you're not prepared for, not just in your routine office, but they'll say, doctor, this happened to me, and show you a terrible photograph, or they'll open a wound, something they've been hiding from themselves. So I think the fundamental work of being a doctor is actually just being a witness. There are many treatments that we're very successful at, but as you have your careers, you'll see that there are many conditions that really we can only sort of partly manage. We can't make them go away. We treat them. Some of them, they have no treatment. But our main job is to listen to the patient and keep them company through that experience of whatever their illness is, whether they're going to recover, whether they're not going to recover.
ustedes, el trabajo de los médicos es escuchar al paciente. Thank you, Dr. Quanta, for this soulful explanation what it is to be a physician. Because the physician has the knowledge, but also needs to have to work on their soul in order to provide complete health.
So that's a nice way to put it. I would say that when you're a physician, it's the patients that will temper your soul. Almost like to make a really fine sword, you have to have a swordsmith that will do his handiwork and make it more and more effective and more beautiful. I think the more you're exposed to patients, your patients are your mightiest teachers. We're all very lucky to have tremendous professors and also colleagues. You'll find that you'll learn from your colleagues at every level of your medical career, but it's the patients that really improve us, like we're in a crucible. And the more patients I will recommend to any doctor, see as many patients as you can. You're going to start to see as your career advances, there are two types of doctors. There are those that just are always surrounded by patients. I'm one of those because I will do anything to not have to go to a meeting. I don't really like meetings. And then there are those doctors who move into the zone of meeting, administrating. They almost never see, they kind of retire from touching a patient, treating a family. And that's their preference. But I think they're less enriched by it. And I think there's no point in your practice of medicine where you have learned everything. You continue, it's just amazing how you continue to learn. I'm going to tell you one story. Remind me, someone, that I want to tell you the story about how I learned that a doctor is closer to their patient than their spouse or their priest. I want to tell you about that story. We're now going to start to see some more difficult things. Please, this is me talking to the Israeli police detectives. Because there were so many dead, there was no morgue in the nation big enough. They had a morgue of about 200 capacity at the Ministry of Defense south of Tel Aviv, so I'm here. But they had to build, within the first hours of discovering the attack, they built a mass morgue, which was operational. I think the attacks were on Saturday morning. It was operational by Sunday. And so here they're preparing for me, and there's a man looking directly at the camera, and he's also an Israeli. His name is Ali Droresh, and his cousin was an emergency medical technician. I guarantee you've all seen his picture. He had a little bow tie. He was a Muslim. And when the students in the revelers in the party were beginning to be massacred, he started to administer first aid as an EMT. He was there with an ambulance at the rock concert, and Hamas came and executed him while he was tending to his patients. So this is his family member who, after they buried him, immediately came to respond to the needs of the dead at work. And I just think he has a very haunting expression. So they're telling me, and they're in, you can see their faces. This is the commander. And I said, how did you choose your team? And she said, for something like this, you don't order somebody to come and work, even though she was a senior commander. This is about who volunteers, and she was overwhelmed with the volunteers. Everybody volunteered, but she didn't feel she could ask any of her subordinates, can you participate in the work that we have to do? They all viscerally responded. Go to the next. So you see me here, I'm standing outside the building, and these are many stretchers. You're going to see lots of patients on stretchers, you probably already do in the emergency room. These are stretchers that have been used to carry human remains, bodies that were brought from the places I've walked through or the music festival, and also remains, meaning partial human remains, were brought. And I must say, I'm about 34 years since I was qualified for medical school, and I was thinking, why would you need a stretcher for body parts? Like, because the stretcher I know you could need for a 6-foot-long man, but not. And they said, because we're not going to carry human remains like it's groceries. We are going to carry them with dignity on this. So I got a little ethical and moral education myself. They're deeply stained. In the first 2 weeks, I was entering week 3 by the time I was there. The human fluid was up to the mid-shin, so everybody was given this kind of protection. Many of the workers were explaining the smell. They're explaining their inability to actually be around their own children because they were handling so many remains of dead children. So many of them, they were relatively young people. They sent their children to their grandparents. Some of them were still living with their children, but couldn't touch them. They could talk to them, couldn't touch them. We'll keep going forward. So they're talking about the way that they were suffering doing this work. You can see, if there's a pointer right at the end, you can see a little black and white object. That's me at the end of the, if you can point to that, are you able to point to that with your pointer, where I am? Right at the top, that's where I am. So I'm about 5'4". These are all refrigerated containers that contained bodies. And that day I counted about 25. Most of the containers the day I was there were empty because there were about 80 or 90 bodies waiting to be identified. And so I was just trying to convey the scale. And the last time I saw containers had actually been in the epicenter of the global pandemic. 6 of the 8 global epicenters of the pandemic came to Long Island, where I practiced medicine, after they went from Wuhan to Milan to New York. And so that was the last time I had seen containers. Let's go forward. And I was there to see what's in the container. Keep going forward. And keep going forward. And we'll stop at this picture. And this is showing you, these are body bags. They are on steel shelves. It's cold in there. It's refrigerated in there. It's got a very unrecognizable smell that was not familiar to me. Some people were not wearing masks. I don't know how much the mask could really help you. But what they wanted to show me is that exactly what I told you. Some of the body bags were as long as a full adult, and then some, like the blue one, were much shorter. And I interviewed people who carried the body bags and took their testimony, and they said some of them were much smaller but unusually heavy. They didn't understand how something small could be heavy. And another worker, senior worker, they have a rabbinical unit in the IDF that is a religious unit that takes care of the bodies of people fallen and how to manage them in keeping with their religion. And he said he would carry a body bag and he could feel the charcoal crumbling beneath in his fingers as he carefully carried the bag. So the entire experience that they were going through, and not to mention this is their own population, their own nationality, and for many of them their own religion, was very traumatizing. One person who saw this, a friend of mine, an Israeli, looked at this picture and says, "Oh my gosh, the shelves remind me of the barracks at Auschwitz, the way people that the Nazis were imprisoning and committing to death in Auschwitz, which was by incineration and starvation, lived in accommodations a lot like this." And so very early on, witnessing this to the national population and the international Jewish community was already reactivating memories of the Holocaust. And that's a whole other interesting phenomena. Let's go forward. Let's go forward. Now we're going to see some pathology. And so I'm going to try and warn you, I think, in the beginning. We just see the people that are running the center. Please go forward. This is the Abu Kabir National Center for Forensic Medicine. This man who's beaming in this remarkable, remarkable physician. And I'm just very happy to meet him because he's giving me so much trust. And in this terrible, terrible period of atrocity, I discovered an ebullient, resilient spirit. And I mean, he's done heroic work. You're going to see his work. He's called Dr. Chen Kugel. And I asked him, why did you become a forensic pathologist? Like, who would want to do that? And he said, well, to tell you the truth, as a youngster, I began to be a saxophonist and a jazz musician. And so it was very important to me that I do some kind of medicine that wouldn't interfere with me playing jazz in the evening. And so that's how we started our conversation. And so one of the lessons of that is medicine is so diverse, you can make any lifestyle that you would like as long as you're committed to managing the balance. And we can talk about the balance, and there really isn't a balance, but make sure that you're feeding all of your passions. I would not sacrifice a fundamental passion and then become monastically involved with medicine, because ultimately you'll resent it. You must keep some of your passions alive while you do the work of a physician. Now, these are 2 different days. Look at the expression of the lady that I'm standing with. So I'm about to get on a plane and go back to the States. She's looking crushed. And this is Nurit Bulbit, who is the head of the DNA laboratory. Her responsibility was to identify every human remains that was presented to her. And he was very keen I learn about that process. So I sat in front of her desk. She was with another colleague who stood right over her shoulder. They were checking lots of numbers. They were looking at several computers. It was like a frenzied process that was going on. And so she kept apologizing that she couldn't talk to me. And I said, no, I know you're working. And then ultimately she made a phone call, and I realized she was verifying in triplicate that she was correct about the DNA. And she was delivering the news to a family: I have found your daughter. I have found the remains of your son. And as I watched that, I was thinking the number of times I tried to make sure I have the correct diagnosis and I have the correct medical record. I haven't mixed up the names of my patients. Did I make a mistake that, I need to order this treatment? But I never thought about the consequences of what it must be like to be certain to return a dead body to the right family, or parts of a dead body to the right family. And so the reason she's looking so crushed is when she finally finished doing that, I just sat there and said, how are you? And instead of actually telling me how she does her work, this was the first moment she was able to weep and speak about her feelings. Many of the professionals, the way they cope with this atrocity was to come to their work, whether it was the morgue, whether it was the forensics lab at 5 a.m., work until exhaustion at 11, go and sleep, because she said, that's all I know how to do. I don't know, she couldn't function with anything else. And so it was a very overwhelming conversation that we had. And then she thanked me because it was the first time she was able to express any of her feelings. And that happened again and again and again. So if you're trying to be a witness, and I struggled with this. I had an opportunity to go there, but I thought, I don't want to go there just to be a voyeur. I don't want to go there just to have Instagram followers and be some kind of grotesque self-promotion. So I was very deeply contemplating what are my motives for going. And then I thought, I'm not Israeli, I'm not Jewish, I'm not actually treating anybody, I'm not licensed to practice medicine there, and I can't carry a weapon, so I'm sort of going to be in the way in a nation in crisis. But actually, universally, people were so thankful that I had come to see and come to hear. And it was a really shocking discovery for me that there was some kind of therapeutic value in just being a witness and saying, tell me what happened. And so that was a new discovery for me. Now we're going to go forward. Because I am a physician, and you will discover, because you are physicians or physicians-to-be, all societies accord you an extraordinary privilege, access, responsibility, and they separate us from the rest of society. No matter how much our profession fails, and we have a lot of failings in the United States in medicine, we still have this very special place of being moral arbiters. So wherever I've gone in my inquiry into terrorism, because I'm a physician, military commanders will speak to me. Because I'm a physician, children that had been radicalized into child soldiers, they and their families will speak to me. Because I'm a physician, a parliament will allow me to speak to them. A Knesset will allow me to speak to them. The role of physician is so powerful. And about a decade ago, I was reading about the role of doctors in Nazi Germany and in the Holocaust. And that is an area I hope you're studying at some point, even privately or in your school. There could have been no Holocaust without the legitimacy medicine provided to the Nazi ideology. When the Nazi ideology and Nazi party was gaining momentum, the number one members of the Nazi party were the physician body. And that was because the party had mandated universities, you can only be promoted from assistant to associate professor if you're a member of the Nazi party. And people were like, well, I need to move up the ladder, and maybe they also subscribe to these rules. So when you have a physician element in society that is corrupted, the society is over. And I think that that's very important. There's a book called The Nazi Doctors, which is brilliant and shocking to read. There's also Nazi medicine. As you know, the Nazis performed diabolical experimentation on human beings, as well as terminating anybody that wasn't meeting their concept of perfection and Aryan purity. And to think about how institutions of medicine, like mine or yours, were integral to that is really shocking. And so I said, I'm a physician. They didn't ask to see my medical diplomas, my American boards, call up my university. They said, please come in, here are some scrubs. And I was allowed into every place and with my cell phone to bring you these images today. So what you're seeing here is a woman with blonde hair who's got a lovely smile, and she has just started pathology residency. So 3 months earlier, she was a medical student. And now she was working to identify these bodies. And then the lady standing slightly apart is a senior professor of pathology, and then the others are volunteers taking notes, and somebody was a dentist that had come in to be a cameraman. I mean, it was all hands on deck. Most of these roles, nobody had any payment. They were also doing it as a call to action. We'll go to the next image, because in the next room, I saw this. Can anyone recognize what these are? Very good, they're teeth. Can you tell what kinds of teeth they are? If you look. Sorry? I didn't hear that word. Did you say shark? Yeah. So what are you referring to? What do you mean by that? Who said that? Sorry, show me your hand. Yeah. What are you noticing? What makes you think about that? Is it that the shape looks different to you? The color looks different to you? So I think the tooth at the bottom is a molar or a wisdom tooth. It's on its side. It's got a flattened surface and a shorter root. The teeth at the top are probably incisors. That one with the curve is probably your front teeth, your Bugs Bunny teeth. And then also there are other teeth, some of them in partial remains. These are human teeth that have been incinerated. They're not belonging to the same person. They've been gathered from an IDF base that was stormed. The soldiers were almost entirely female because they had very good visuospatial skills to look at radar and drones. And so they were captive at the mercy of Hamas. And ultimately the building was razed to the ground. And so DNA material can remain on human remains if they've been burnt. To about what temperature do you think? Take a guess, because I didn't know.
126 degrees Celsius.
So up to about 700 Celsius, I was informed that there can be some remnants of DNA that's identifiable, some remnants of organic material. Thermobaric weapons typically burn at temperatures of around 2700 Celsius. So nothing remains. These are the remnants of human teeth, but they're calcium hydroxyapatite. They have an abnormal color because they've been incinerated. And so these teeth were being studied by Dr. Michal Peer, who was a PhD in the thermal injury of dentition. And why do you think we would need to know about thermal injury of dentition? When might that be needed, apart from in the horrible occasion like this? Unfortunately, when people have car accidents, that's the commonest reason. And sometimes the car catches fire, there's petroleum in the car, and also your dental pattern is one of the most unique identifiers of each human being. Because when you can't recognize people, you often use dental records. And so there's an entire scholarship looking at this field of dentition, which I also didn't know until I sat there and listened to what she was doing. Now, if we were trying to identify me or you, they would, God forbid, they would be finding our dental films from our dentist, and I can guarantee I have a lot more dental work than somebody your age. And so my dental x-rays would show all kinds of interventions, and that would be very easy to say, well, I see remnants of interventions, this was probably this person. Younger people have much less intervention, and most of these soldiers had perfect teeth. And so you're looking at dental films from their last dental visit, but with no distinctive features. And so the only way that they could try and attempt to identify them was to say, well, I found it here, and where is that on this architectural map, and which soldier was assigned to sit in that spot? And then that was the only way that they could deduce that this might be a remnant of that person. That's the kind of work. And there were 4 doctors poring over these teeth, for hours. It's sort of amazing to see the dedication with which they were trying to solve this. Let's go to the next. Who can recognize this? What is it? Somebody said spine, but it's not the spine. Vertebra, vertebral body, right? And so it's the remains of a vertebral body. Again, it has no organic matter. Again, it's been burned to the same temperature. And there is one feature on it, if we can, I don't know how to point to it, but at the top, sort of towards the fingers of the gloves, there's a very smooth, there's a lip around, it's like a ridge around the vertebra. Are you able to see? There's a nice lip at the top of the vertebra. And so the pathologist explained to me, oh yes, thank you, that would be great, but need a little glass. Probably need a little glass. So a pathologist explained to me that ridge, I don't know the anatomic name for it, forms only by the age of 16. Before 16, it's not contiguous. And then it remains in this nice smooth formation until we're about 40, after which we start to develop osteophytes, and it becomes more rugged and more irregular and not as contiguous. So he was looking at this quite small, he's got a big hand, and I'm zooming in, but he was looking at this quite small bone and realizing, well, this was between 16 and 40 years old. And then where did we find it on the map? And again, it was found in the base of where the female soldiers were. And so they were trying to relate that to which soldier might have been. And that's all that remained of this human being. I think now we're going to get to the more challenging images. So please feel free, if nobody wants to see them, there's no obligation at all. Please go to the next image. Please stop here. Is anyone able to say, now only because I'm telling you do you know it's a human remains, but is anybody able to say what you think you see or describe what you think you see with words that doctors might use? Or any kinds of words that you want to use? Well, does it look like it might have been burned? Yes. So it looks like it's charred. I see something curving. Do you see some curves on there? And what does that remind you of, if anything? And I mean, I also looked at this and couldn't compute it. Does it remind you of anything at all? Okay, that's interesting. I was thinking ribs. And anything else you want to say? I'm glad that you're... where did Sandra go? She went to get the water because I wanted her to see this. Can we go to the next picture? Because it's from a slightly different angle. So, what do you think you're seeing? So I'm not sure. I don't think it's that. Let's go to the next image. Okay. So who said it was the gentleman in the gray T-shirt? Yeah, what's your name? Damon? Damien. So Damien was right. Can you see what you can see on the high-resolution CT image, please? Tell me what you're reading there. You can come closer if you want to get a better look.
I can't really describe like
I'll
like an amalgamation of bones and crushed tissue.
Do you see this bone?
Yes.
What do you think that might be, that bone?
The femur.
It looks like the femur to me. It looks like the femur. And then do you see these sort of long, elegant projections going up this way? And you see something curving this way?
I got like wires.
You see wires, very good. And then do you see something curving the other way? If you could help me with the pointer, I don't know how to work the light, the laser pointer. Show me what I have to press to show. Ah, the top one, okay. Where's my light? Oh, here it is. Oh, it's an arrow. So this, you see, my visual space, why is it not following my finger? Okay, so you see this.
Yes.
That is a spinal column. And then you see over here. Yeah. How many spinal columns do we normally have? One. So this is how many people? Two. Okay, and then there's something up here I see, which I believe looks like, what do you think that is? Oh, you think it's teeth. You know what? That's very intelligent. Oops. Oh, God, I didn't see how high that was. I don't know if that's teeth. I thought that was part of a C-spine, but it may be part of teeth. And then the most disturbing, well, all of it's disturbing. I think these are ribs. And then there are these. They're actually steel cables. And what do you see here? What have they done with the cable? So I think let's go to the next image. There's one more image. Yeah, thank you, because I'm not that great at working it. We'll go to the next one. And these have been reported in the press. Let's go. Is that the second image? Yeah, it's a slightly different angle. So when you do a CT, you'll be in any profession of medicine. We now have the privilege of so much imaging. So one of the skills of being a good doctor is being really observant. And that only comes with looking at many things, learning from people that have looked. You are probably going to be training with the help of AI that's already reading, artificial intelligence that's already reading many images. But when you look at something that you've never seen before, you have all these other skills because you're very good at observing, because you've been seeing so many human beings. For instance, when I was trained in medical school in England, we were trained to start our examination when the patient walked in, even though we first take a history. So you might see someone has ink-stained fingers, or you might see there's a pack of Marlboro in the shirt pocket, or you might smell that there's a smell of alcohol, or that there's a smell of marijuana. So your examination begins the minute you start to survey the human being that's coming in front of you. And so when you see things that are unintelligible, you've got to rely on a few of your familiarities, so you start to put together. And so what this is this was, in living patients, we use high-resolution CT, we use MRIs, we use PET scans. But when you have forensics, you have no restrictions on radiation dosing. And so for the highest resolution, we use water-cooled CT scanners, water-cooled because the CT scanners get very hot, and excessive levels of radiation to be able to get this kind of clarity from something that was an unintelligible charred remain. And so this image, it was reported in the news very early on. It is two people that were tied back to back. They were bound with steel cords. We don't know what violence was done to them before that, because they may have had other violence as well. And I think that I think that in fact, one spinal column looks bigger than the other spinal column. And I think either one was male and female, or one was adult and child. And so when you see an image like this, this is very deliberate, very premeditated. This is not about, oh, I'll shoot you in the head and move on and rob your bank. This is a level of hatred, a level of eliminationism that you encounter in genocide. And so there were many such evidences. We're going to go to the next. And we're doing okay. It's 11:30. We're doing okay. Do they have another class after this?
Yeah.
When is their class?
No,
Okay, good. So we'll be here as long as when I have to rush off. So this is how body bags come. I've made my best to try and cover any numbers because when I saw them, they had not been identified, but many of these people have been identified. Next slide. We talked to the people who described what it was like to open a body bag. And I want you to remember, when we talk about genocide, when we talk about whatever genocide it is, genocide follows dehumanization with words, delegitimization with words. Words is where the violence begins, whether it's the Tutsis and the Hutus, whether it's the Bosnians and the Serbs, whether it's the Nazis and the Jews and the Nazis and people that were disabled or had, abnormalities, developmentally delayed. So this kind of destruction always begins with words that are moving to otherize and negate and annihilate with language another group of human beings. And after teaching this in many different places, particularly in the last month, this is my presentation that I took to Parliament last month, where I invited myself. That's another thing you must learn to do, is don't wait to be asked. Say, listen, I've got this, can I do this? So initiate and create opportunities for you to share your important information. I now understand what the words annihilation and dehumanization mean. If we think about the charred remains, none of us, with all of our years of experience, could actually tell what it was until we saw on the CT scan. That's what dehumanization means. We're not able to recognize the other as human, even when we're humans ourselves. That's what the perpetrator does, and that's what the aftermath of dehumanization is. And then dehumanization and genocide, genocidal ideology, genocidal acts, genocidal violence result in what I call annihilation. Go to the next image. And annihilation, you know the word, but annihilation means just total destruction. The pathologist pointed out, do you see this? What do you think this roundish bone is there at the top? Yeah, it's a part of the calvarium, the skull. And so the pathologist said, when we see that, we know it was fatal. It's not like you can fracture somebody's skull and they get up and go into an ambulance, or somebody can save them. That's life-ending. And so I want you to think about the words when you, even in medicine, outside of medicine, when you read politics, when you read the news, when people use dehumanization, delegitimization, annihilation, now you've seen it. Now you've seen it reach its nth degree. Let's go to the next. The next. Many, many. How about this? This was brought by some kind of incredible first responder who was going to those places where I had seen, and they were carefully sweeping up in the remains of this atrocity what they thought might be pieces of a human being. And when I see this, I thought this was just pieces of the ground and maybe some compost, and maybe you're going to put it in your flowers to help them grow. And then this was put through the high-resolution CT scanner. If you go to the next one, and you see that it's actually fragments, human fragments. It's sort of quite incredible and quite shocking. And I think you're all very brave for looking at this. And again, nobody's obligated to look at it. If you don't want to listen to me, you're free to leave as well, because these are not easy things to begin to contemplate. Again, we see what Damien said, is we see those sinister steel cords. You see pieces, I don't know what these bones are. I think I see the top of a scapula and maybe I don't know whether, actually it might be a pelvic bone, and it might be something like a tibia or fibia, the very lean bone at the bottom. You see a rounded bone. I'm not sure if it's a piece of skull. You see a longer bone. This was a human being. This is a human being that's been decimated. And that decimation has happened because of the hatred. We're going to go to the next slide. We're going to the most difficult pictures. Before we do that, do you go to a cadaveric lab? Is that part of your education as medical school students? No? Is that coming later in their medical school? Which is called dissection, anatomical dissection.
Yes, they usually practice like on the skill labs on dummies, but they haven't achieved the real life thing.
When do they do that?
I think after the
In a year?
semester.
Next year or? Okay, so medical school training has changed so much. So when we trained on the first week, we were brought to meet the cadaver, and then we worked for 2 years on the same cadaver, and it was the same 6 students on each body. So for 2 years, you get very connected to your 6 team members, and you get connected to your cadaver. Now, many medical schools, I think even the United States, they're using simulation, and they have or digital imagery, and I actually don't know how much they're working on human remains. But we're going to see some human remains. But first, what are we seeing here? Can anybody tell me what we're seeing here? Zip ties, yes. And why do you think we're seeing them?
Because they were used to
Yes.
handcuff the prisoners.
Right, but why are we seeing them? Why are we seeing them here? They were recovered, exactly. So they were recovered on human remains arriving to the Forensic Institute. We're going to go to the next slide. This is a difficult picture. So this is how some remains arrived. So I was there in the 3rd week of October. I didn't take this picture. This was provided me as evidence. Obviously, it's a, what can you tell me what it is? It's a hand. What do you see on the hand? You see the zip ties. You see some missing, well, we call them digits, right? So missing digits, very discolored, probably burned, but also lots of dehiscence. Do you know what I mean by dehiscence? Yeah, and the dehiscence is the putrefaction. There's 2 kinds of decay, liquid putrefaction, and then also there's a mummification. Depends on where the body is found, what the temperature was, what the organisms were. But this was someone who was executed with zip ties. Let's go to the next. I think you press return twice on this, and one more image going to come up on this slide. Maybe, let's see, yeah, stay here. Some bodies arrived like this. So what do you see in this picture, anybody that wants to tell me? Speak up. Speak up. So it's an electrical cord, a domestic appliance cord, and? Yeah, it's wrapped around somebody's wrist. It looks like it was wrapped around the other wrist too, correct? We can't see that. Obviously, it's a dead body. Again, you're seeing dehiscence. The skin is coming off because it's decaying. Sometimes you see these kinds of dehiscence and what we call degloving in skin infections and after burns. And also there's something called degloving if somebody goes through a motor vehicle collision through a windscreen, head first with arms, and the skin is stripped off. So you'll see people with this in real life. But this was so shocking to me. And this does not mean that people are using a word pogrom, and if anybody knows, I don't know how many people are with knowledge of what's happened to the Jewish people in history, but pogroms were in the 19th century, and they described them as like a mass fury at the Jewish group and massacred a bunch of people. And then things settled down for a while, and then it would happen. And pogrom implies that this was just people who had a lot of hate overcome. But we know that wasn't the case. This was pre-planned. There was efforts to document it before they arrived. They had lots of zip ties, but sometimes if they ran out of zip ties, they used whatever was available. And so I think that kind of intimacy of the killing with their own weapons while whatever injuries to the body were rendered was very shocking to me. Let's keep going. Keep one more click, and then I think we have another. This is similar. What I think is, leave the other image up. Oops, we've lost both images. Next one. Forward. That's it. And one more. Let's stay here. So what I think by looking at this body, which had come in to the forensics, face down, and probably hands behind the back, so also being prepared to be executed. The only reason the cord is loose on the hands is because of the decay. You keep going. Keep going. We've seen enough of that. This was the body that I examined myself. When I arrived, there were 3 bodies that had been received. And so I walked around the body. I've seen a few autopsies. I worked in the cadaveric lab as a 1st and 2nd year medical student. Once in a while, I don't understand why my patient died. You take consent, and you can learn a lot. And the pathologist is always very happy when the physician comes, because the pathologist only knows what's in the medical record, but the physician often knows the full history. And so the last time I went to an autopsy was during the pandemic, when we were having so many deaths so rapidly. And one of my patients who I thought was getting better and needing less oxygen, and I was planning a tracheostomy to help with the mechanical ventilation, suddenly had a cataclysmal cardiac arrest, and after 3 hours of resuscitating, died. And I just was so unable to comprehend what happened, so we went to the autopsy of that patient. And in that patient, there were limitations because of the pandemic. You weren't allowed to open the brain. You weren't allowed to open the skull because of aerosolization. There was no vaccine then. And so only the chief pathologist and the consultant physician were allowed during the autopsy. Medical students, residents, everybody else was forbidden. So the last time I'd been to an autopsy was then, which was, I think, May 11th or 10th, 2020. So now I saw this, and the first thing they said is, we don't do an internal examination. We only do an external examination. What do you think an external examination is in an autopsy? Speak louder. Right, so what are we inspecting? Looking at the appearance. The single most important skill, I think, in physical examination is inspection. Because you've got to see what were the scars. Did they, obviously not in the case of terrorist violence, but was there a liver transplant? Was there coronary artery bypass graft? Was there appendectomy? Maybe somebody was a breast cancer survivor. Maybe only have one side is reconstructed, the other is normal. You learn a lot by inspection, and so one reason is the reason here was. The cause of death was evident by inspecting the body externally. So there was no clinical indication to inspect the inside. It didn't really matter if the body that we were examining had a renal cancer that was in development, or had a COPD and emphysema, or maybe had a pulmonary embolism that nobody knew about. That didn't have any material impact on the cause of death. And so first thing you notice, what's the first thing you notice about this body? The color of his face, okay, so true, it's very discolored. It's also very edematous. I think you can see the tongue is very swollen and is emerging from the mouth, and that's related to the decay. It could also be related to an injury. Maybe he had actually some ligatures around the neck, I don't know. I notice that his hands are bound with a zip tie in front of his chest. So that was his executioner. That's one of the first things the executioner did. I also notice he's still wearing his T-shirt, and if we can go to the next image, please, we see that he's still wearing his cell phone earpiece. So this was someone who was completely not expecting to find himself the target of combatants. It was a Saturday morning, it was a holiday, probably about to go out for a walk, and had his mobile phone equipment. To me, that made him a person, and I wrote about this in the Washington Post, and my sentence when I was thinking about this was, death came as a surprise. So this person was completely taken by surprise. When I inspected his body, he had multiple puncture wounds all over his body where clearly he had been stabbed. He also had multiple bullet wounds, which actually look quite small when you look at where they go in, but when we rolled the patient over at the back, gaping flesh wounds. Because when bullets go in, they make a small entry, and then they revolve and revolve and revolve and make a big exit. And then also you see vaguely, because it was very difficult to look at. There was something wrong with his legs. And so the pathologist doing the external examination lifted up the leg from the knee and the ankle to show me. So she held the knee and the ankle, and the entire leg bowed like ribbons of flesh. All the bones had been crushed. And actually, that's the only time I felt a little bit sick, not because of what this was smelling like or what this was looking like, but because it immediately catapulted in my memory to an injury that I treated in about 2000 when I was a critical care physician in Saudi Arabia, and I had a lot of patients that would come in as motor vehicle collision, pedestrians that had been run over. And the nurse said to me, "Oh, Dr. Ahmed, you know what? I've got to just set the leg. Do you mind just holding up the knee and the ankle for me? That's not really my job, but I was there, I was happy to help." And then as we lifted up the knee and ankle, the entire leg bowed. So when I saw this body, I suddenly was reminded of a patient that I'd seen 2 decades ago. And I remember when we helped bandage that leg, I felt very sick at the deformity of the limb. And it's that visceral memory that came back when I looked at this. So you'll be very surprised as physicians when you're seeing things, you're absorbing enormous amounts of information, suffering, pain, and we have this like force field around us because of all the years of training and because of our profession. And the white coat, I think, is more than symbolic. It's like your Superman uniform. And even if I'm not wearing it, you have the title doctor, and it keeps you shielded and protected. But once in a while, a painful memory will break through, and it's just important to notice that and remember that you are human, and some things are difficult to behold. So the other concern I had after I saw this body is, Yet again, here's another body. There's been multiple forms of injury. Maybe some, actually now that I think about it, because I've looked at this so many times, but the head looks peculiarly swollen and the neck has a ligature mark. So I think he may well have been strangled. And you had mentioned hanging. I don't know if people were hung. I haven't heard that. So that's the question I'll ask. And stabbed and shot and legs macerated by a vehicle or a massive force being applied to the legs. Multiple forms of executions prosecuted on the same body. That's again genocidal injury, genocidal intent. Let's go to the next. Dr. Chen Kugel gave me many photographs. People had what we call defensive wounds on the hands. So wounds on the back of the hands. The perpetrator is there, they're shielding themselves, and they're being stabbed or shot through the hands. Let's go to the next, or wrists. Go to the, one more click, and I think we have 2 images on this slide. I took verbal testimony of people saying, we received bodies that have been eviscerated. Is there any medical or surgical indication for evisceration? Do you know what I mean by evisceration? Speak loudly. All the ladies are speaking quietly, and everybody must learn to raise their voice, not shout, but don't be afraid. So who said that? Very shyly. Tell me what you think evisceration means. Yes, and does that have any purpose? It's okay. So maybe you're thinking about if somebody has ulcerative colitis and needs a total colectomy, right? But we don't call that evisceration, we call that total colectomy because we take out the colon, we repair the rest, we close it up and we make a wound. Evisceration is done purely for brutality and torture. And so I wanted to see the reports I was gathering, and what you see is the abdominal wall is removed. That body is severely burned. That may be partly why the limbs are not intact, but there were reports of mutilations. And when you turn the body upside down, you can see all these knife wounds in the skull. And are you okay? And you see the hands are also still with the zip ties. So people were eviscerated. Actually, let's go to the next image. Hold on, don't put any more photo up. Leave it blank. Next image, but leave the screen blank. Move, that's it, stay there. Yeah. Thank you.
How do people recognize that body? For example, yeah, I don't know how to...
How does a physician that's walking, in order to recognize the deceased person, so who was it? How do you, like those eviscerated bodies and calcinated bodies, how do you...
tell you the families of like people who look like that to recognize the body. It's like, yeah.
So these bodies still had some remnants of organic matter. And so that's where the DNA lab would have come in. But mostly, a lot of this atrocity was filmed live. And so the authorities were able to correlate, this body was found here, the first responder would say, in this house, in this room, at this address, and they had the social media footage and the body cam and the live. And so it was actually, a lot of it was not in that context. And they may well have worked on some remnants of the DNA. I didn't inquire about each photograph that was provided to me. And in fact, I don't know if this person has been identified since then. But for me, what was important is to see, I'm seeing a person who works in a morgue. I'm seeing many people and they're telling me we saw bodies with evisceration. And then we go to the forensic lab and we see a body with evisceration. So that builds a tremendous amount of corroboration that people are telling the truth. They were not exaggerating. They were telling the truth. Let's go, I don't know what is next. Let's see. And the next one. What do you see in this image? Is there a question, ladies? Yeah, is there a question you have? This one? What do you think? Ladies, what do you think this is? What kind of image? That's an X-ray. And I think this is probably high resolution and reconstruction with digital subtraction. We now have these amazing CT image machines that can reproduce and give you a three-dimensional quality of anything that you want to see. And again, it would have been with the settings and machines that we don't use on clinical patients. But more importantly, what do you see here? Let's ask somebody in the front row. They've been very quiet. The back, it's usually the opposite. Yes. Can you tell me what you're seeing? So you're seeing a skeleton. Yes. You're seeing fractures. Can you point out any fractures that are striking you? Pelvis, very good. Is it easy to fracture a pelvis or is it difficult to fracture a pelvis? Pick one. Or you can phone a friend and ask for help. Yeah, you need a huge amount of force to fracture generally a healthy pelvis. When we would see them in critical care medicine, we would see somebody who had a pelvic fracture if they'd been hit by a Mack truck, like a really big car accident. Sometimes we'll see it in a very old lady, 80 or 90, severe osteoporosis and falls down a lot of steps. And then there are other patients that have bone disorders that might have pelvic fractures. But it's sort of amazing, not only the fractures, I see fractures in the upper extremity, I see fragments of bone, I see a massive fracture in both femurs, and you see pelvic fractures. So the only reason I'm showing you this is that there was a lot of radiological evidence of trauma as well. And also there's been this entire silence over the sexual violence, but many reports of females gang raped until there were pelvic fractures. And so we don't know the history of these images, but there was an overwhelming amount of evidence in many kinds of medical samples. We'll go next. This actually was a 25-year-old woman who was incinerated. You're seeing her teeth, and you can see her orbital bones. Can you sort of make out that there's a kind of an impression, almost like somebody that was left behind at Pompeii after the volcano exploded historically, and I think she's lost most of her skull bone. And the reason I show you this is people have said, well, there were no accounts. Nobody came forward and said, well, I was gang raped and I was violated and my breasts were amputated, and my vagina was impaled with a knife. All of these things have been seen on bodies that were found, and there have been some eyewitnesses that also saw these atrocities occurring. But most of the women were reduced, totally destroyed by incineration or mutilation, and so they're not able to come forward. So it's very important to realize, just because you don't have definitive evidence of somebody saying this happened to me, does not mean that sexual or gender-based violence did not occur. In fact, the rabbinical officer in the morgue told me that the terrorists seemed to have a real appetite for amputating breasts. They received many bodies where the breasts had been amputated. They received bodies where male genitalia had been injured or castrated, and they received bodies where knives were still impaled in the vagina. So there was sexual violence. There just may be nobody that can tell us about it. We know that there have been hostages. One extraordinary hostage who's been recovered from the Hamas and talked about her sexual violations that were done to her while she was in captivity. And there's also a lot of evidence to show that sexual violence, if any hostage is alive, is still occurring to men and to women. So that's also another way to dehumanize and totally destroy a person, destroy them psychologically, destroy the fabric of their community. And that's the intent when women's bodies and girls' bodies are used as a battlefield in wars. The intent is not just to destroy that woman or girl. The intent is to tear apart the entire community, because it's an almost insurmountable assault on a community. Keep going. This is to show you more child remains. The only thing I recognize here is the liver, and of course the jawbone, and maybe a bit of the trachea, and possibly the lung, fragments of mandible. Go forward. This was somebody actually who was shot in the head. He was shot in the head in front of his family. His family was later kidnapped and then taken away into captivity. And then later he was decapitated. And we see videos of this sequence of events that are occurring. This person was not burned. You can see just ecchymosis and the clavicle bones and all of the large vessels that are exposed. Keep going. This is the last image. What do you notice here? So everybody's having a reaction. Teddy bears, yeah, teddy bears. What's wrong with the teddy bears? They're charred, right? So they've been burned. And who might have a teddy bear? A child. And is there anything you notice in the other frame? You notice hair, very good. So you've identified the head. Do you see anything on the head? Sorry? You see a blanket? Is that what you said? Yeah? Speak more clearly, please. Sorry? Something woolly. Okay, you see some knitwear. What's this white object that's sitting, that's right catching our eye? And everybody's pointing somewhere here, right? What are you guys pointing to? Why do you say they might be deaf? Excellent. Excellent. Maybe you have a future as a forensic pathologist. So that's a hearing aid. That's a hearing aid. And that was a grandmother. And so the grandmother was murdered with her autistic granddaughter and the toys of the autistic granddaughter. And so some of what we're looking at, let's go to the next slide and they can take a break. There are no more images. We can just chat and put the lights up. So sometimes when you're looking in these places, you actually find that, like I was so transfixed by the Java jawbone piece, and sometimes you'll see something as mundane as a hearing aid, and that will help you correlate it. And then she was found in wherever she was found. They knew it was a grandmother, they knew it was a child, and then the child was incinerated along with the toys. There were some people that were also incinerated along with the family pets. So this isn't to say I want you to go away and study Islamist totalitarian ideology, which I've done in parallel to my medicine. And the reason I did that is I was an intensive care doctor in Saudi Arabia on September 11th, and I saw the planes go through the towers, and I'm Muslim, and I practice Islam, and I'm thinking, what the hell happened? What has happened to people in my faith? How could this be? How could this occur? New York was my home, and so that was a pivotal shift. Until then, I was only obsessed with knowing enough things to look after my patients and advancing in critical care. And then this developed a parallel field of inquiry. But if we take a step back, I never planned to be a physician. That was not my choice. I'm a daughter of a physician. In my family, women have been going to medical school for over 100 years. In India, with one of my late aunts, was a extraordinarily gifted medical student in 1938 and received a medal from the Viceroy of India at the time. So this is like, you often fall into the profession that your families know, but I had wanted to be a journalist. And at 15, I said to my father, I'd like to be a journalist. I'd like to be like Christiana Manapur, who was like a brand new journalist then, and she was reporting on the Bosnian genocide. And my father said, no, you're going to medical school. And I had no personal agency then, so I was slated for all of the tests for medical school, and that was what I did. And then I never thought about journalism again, though I had always loved to write at school and loved reading. But I realized, as I started to see medicine, and my program in the University of Nottingham was an accelerated program. It was innovative in its time. We did a medical degree in 4 years, and we saw patients as we did academic classes from almost the first week. We didn't treat, we just, looked at patients, talked to patients. After we had a foundation of knowledge, we began to do our clinical rotations. And I found this the most enthralling activity. You go and meet a stranger, and you say, why are you here? What happened to you? They tell you all kinds of things. And then you'd have to write it down in a coherent fashion and then try and guess what was wrong with them. And I thought that was the best thing since sliced bread, because the patients were so fascinating. And it's like being a detective, but it's also a bit like being an investigative journalist. and then maybe the patient doesn't know the whole story, and then you wait for the spouse, and then you go away and you see them the following week, and you think, well, I forgot to ask you this. And you little by little assemble a very complex puzzle. And so I learned much later, I had already qualified as a consultant, that medicine gave me all of the skills that I might have wanted to be a good journalist of some type, even though it didn't occur to me to become a journalist. What happened is witnessing an atrocity and being a physician made me feel, this cannot be right. I need to do something about it. And the only thing I can do is read and learn and then eventually write, which turned into a book. And then once you write a book, I hope all of you get to write books. It's never for money. There's no money in writing books generally. But a book is an extraordinary credential because people suddenly say, well, would you write in our newspaper because you wrote a book about this? And now events happen, and now you begin to say, well, I have an opinion on this. May I publish? And then readers read it, and they react to you. And then what happens there is you end up learning, and then you write something else, and suddenly you're an authority. And this is almost like an informal credential that becomes extremely powerful, but particularly if you have the foundation of a medical career underneath. So I would say we're at 12 o'clock, and I had wanted them to ask questions, but unfortunately, maybe we're going to have to rush off. I would say, first, you are entering, even with all of the frustrations and all of the, in the United States, corporatization of medicine, you are still entering the most noble profession. And don't let anybody take that away from you, including greedy administrators who might just want you to write a lot of bills and make a lot of profit. Your profession is noble, and there is no other profession of that nature. And I have all my friends running hedge funds, corporate lawyers, judges. There's no profession that comes close to being a physician. And it'll remind me to tell you about the story. And the story, and I'll leave you with this story, and then I'll give you, sometimes you'll learn something from your teacher, and you won't understand the lesson for 25 years. And so my first teacher in the United States, I was, I think, 20, I finished medical school, did 1 year of housemanship, and then I came to the United States to be an intern. And my first teacher was Dr. Michael Amazzoloso, who had a very long Italian name. He was a very short doctor. Amazzoloso means kill the bear. That was the translation. And he had been a Jesuit scholar before he went to medical school. And he decided, instead of becoming a priest, to become a doctor. And one day he said to me, you know, Kanta, when you see a patient, you are closer to that patient than his spouse. He's going to tell you things he would never tell his wife. She's going to tell you things she would never tell her husband or partner. And they're going to tell you things that they don't tell their priests. And he wasn't talking about Catholics specifically. He was just using that as an analogy. And it really stayed with me. And so I now and again used to wonder about it. He ultimately, in fact, had one cancer, survived one cancer, and then ultimately died of a pancreatic cancer. And that in itself, when you start losing your professors who are physicians, and you see how physicians respond to their illnesses, is an incredibly powerful education. And that was his final gift to me, is how he lived through his stage 4 metastatic pancreatic cancer for 4.5 years and still came to work until the last 2 days of his life. So I had carried this wisdom inside me for many decades. And in March 2020, the pandemic arrived to New York. I'd long given up critical care medicine about 14 years earlier. Now I sit in an office, I treat people with sleep disorders and can't breathe in their sleep, walking in their sleep, seizing in their sleep. And I knew as this pandemic was coming closer, how would I feel about just seeing people in an office or on video? I felt like it was unconscionable to not go and support my critical care colleagues and say, listen, I knew all this stuff 15 years ago. can I come and help? In the next afternoon, I was managing an ICU, and that's the other thing you learn, is the knowledge that you have in you is so imprinted. It is like riding a bicycle, and I could remember the medicine, I just couldn't remember which way to go in the elevator. So it's really a huge investment you're making in your education, which will never leave you. And now, some weeks into managing this pandemic, where people had extremely high level of mortality, in 10 weeks of working in that ICU, I saved only 2 lives. Everybody else went out in a body bag. I had one patient who was really a very wonderful 60-year-old woman, and you probably heard in the pandemic people were severely hypoxic, but they were not in respiratory distress. So for the first time in my career, I was consenting people to put them on ventilators because they could speak, but they seemed not to be able to oxygenate. And at that time, we were putting everybody on mechanical ventilation. And so then began her long course, and I knew before when she said, I said to her, you know, and you can read this, I published this in the news, we're going to have to put you on a ventilator. I know, Dr. Ahmed, but will I be able to get off? And I said, nobody knows the answer to that, but I know that I can't leave you in this condition because this is not tenable. And so with a lot of fear, and I was also very disturbed that she had so much awareness. But we made the decision, we put her on the ventilator, and then she unfortunately had some weeks of severe deterioration, hypoxemia. Now she was clearly dying. So I called the family, and on this occasion, most families were not allowed, but this family gathered in the hospital, and I was telling them there was a young family, they had young children, 15, 16, something like this. And then I said, this is futile. Would you consider withdrawal of care, and what are your beliefs about that? Yes, we don't want mummy to suffer. And then I said, and when they met me, they were a Catholic family, and they had brought their priest with them. And I said, is there anything else you'd like me to do? And they said, we would like if you could give her the last rites. So I'm a Muslim. So I said, give me the priest immediately pulled a printout. Actually, the printout was in English and Spanish because that was their language. I guess they were Spanish, not Italian. I've forgotten now. Her name was Mrs. Vega, and I can say that because their family allowed me to publish the story. So I take the papers, I'm in my whole pandemic paraphernalia. I run to the ICU because I don't know when she's going to die. And the priest told me, please can you read it 3 times? Please can you hold her hand when you do it and say it in a very soft voice? So I walked into the intensive care unit and I said, pointed to nurse, I need you to come over here and witness this because we have to then write that we did it. And then I start to read these words and hold the hand of the patient. And these are not words from my religion, but these are words that I know because I got to the part, which I think is Psalm 23, where we walk through the valley of the shadow of death. You probably know the words better than me. And as I said these words, even now, I mean, the whole week I haven't cried in Colombia with all this terrible stuff. But even now I felt those words are exactly where we are. And my patient is finally being elevated to a better place while we remain. It was an extraordinarily haunting moment. And the nurse was watching, and there was a little rustle. And I saw the husband had come in, and so he took over the hand. And then I continued to read. And then we all felt calm. And then at the end of that, the nurse said to me, that was so moving. She said, and I'm not even Christian. I said, what are you? She was a traveling nurse from Miami. We didn't have enough nurses, so we were renting nurses from all over the country. And she said, well, I'm Jewish. And I said, well, that's interesting because I'm Muslim. And therefore, the last gift my patient gave me, she assembled all 3 monotheisms in the final moments of her life. And that's when I realized what Dr. Matsulosa had said in 1992, and now I'm in 2020, a doctor is closer to her patient than even the spouse or the priest. Excuse me. So, this is why I wear my Hermes, because you can always dust something off. So, you know, we live in it's not just this atrocity. There are many atrocities happening. Of course, there's a defensive war that's being waged that's claimed lots of lives, tens of thousands of lives. It's terrible, and we live in a world which is generally, unfortunately, increasingly unfeeling. People are glued to their virtual devices. People are more connected and less close-knit in their families, digitally connected. They're not able to make relationships. You are entering the most noble, most profound profession. My profession has allowed me to practice in 3 continents, take care of people of all manners of faith, and I'm now in my mid-50s, and I expect that this evolution will continue. And I want you to know what you have in your hand is truly precious. And some of you will become advocates for the environment, some of you will become advocates for the indigenous people, some of you will become advocates for women's rights, some of you will become forensic anthropologists, some of you will become brain surgeons, some of you will become pediatricians, some of you will want to be a GP. There is no limit on where you can go with this career, and your impact as physicians will go far, far, far beyond the patient in front of you, the hospital you work in, or the office where you practice. It's been a real pleasure. Thank you.
Thank you.